Hello, all right?
Oh, no. Thank you for posting.
Prynawn da I chi gyd, a croeso cynnes I gyfres webinar Rhwydwaith Iechyd Cyhoeddus Cymru. Good afternoon and welcome to the Public Health Network Cymru's webinar series. My name is Cerys Price and I'm a Senior Public Health Practitioner for the wider Determinants of Health unit within Public Health Wales, and I'm delighted to facilitate this session on how trade agreements might affect public health issues in Wales. We're very lucky to have some excellent speakers lined up today who are knowledgeable experts in this field. We'll have some presentations from them, followed by a chance for you to pose some questions. With us today, we have Dr. Louisa Pecci and Public Health Consultant Liz Green from the Policy and International Health WHO Collaborating Centre within Public Health Wales. We have Dr. Courtney McNamara from the Norwegian University of Science and Technology, and Charles Whitmore from the Wales Governance Centre and Wales Council for Voluntary Action. Before we start, there are just a few housekeeping items for me to run through with you. After the presentations, there'll be a chance for you to ask some questions. Please use the Q&A box at the top of the screen to type in your questions throughout the webinar. The webinar is being recorded and will be made available on the Public Health Network Cymru's website after the session. English and Welsh subtitles are available, and these can be switched on using the button at the bottom of your screen. However, we're aware that sometimes the Welsh auto-generated subtitles can be a little bit inaccurate. If you do experience any difficulties with the technology, please let us know through the question and answer box, and the team can contact you directly. Now, it's over to Louisa for the first presentation. Thanks, Louisa.
Thank you, Cerys. Can everybody hear me and see my slides? Right, thank you so much everyone for taking the time to join this webinar, and Cerys for that introduction. As you said, I'm Louisa, and I recently co-authored this report for Public Health Wales on trade and health. And I have to say, trade was not really a topic that was on my radar before, especially in terms of it being relevant to health. So writing this briefing really was very much a learning journey for me. But the reason it's on my radar now, and I think why it's important that we're talking about this topic, is because of Brexit. Because when we were members of the European Union, it was the EU that really handled all of our trade deals and negotiations. And now that we have left the EU, it's the first time for nearly half a century that the UK government is negotiating trade agreements with other countries. And the reason that this kind of matters is that we've all got pretty used over those sort of half a century to what life is like under the trade agreements with the terms that the EU would have negotiated. But the UK government doesn't necessarily have to play by those same rules anymore. And that means that we may start to see trade affecting our health in new ways. And that's kind of what I hope that we're going to be able to dig into with this webinar and with my presentation first of all. So I'll be covering what trade agreements are and trying to give you a flavour of the ways in which that they can affect people's health and what that potentially means for Wales. And hopefully by the end of this webinar, you'll leave with greater knowledge of the ways that trade agreements and trade policy may impact on your areas of work in health and wellbeing, and where you can look if you want to explore this issue further and its relevance to your work. So what are trade agreements? There are many different technical types, but I guess a good catch-all description would be any agreement between two or more countries that affects the flow of goods, services and investment. Trade agreements are about opening up markets and making it easier for money and stuff and services and sometimes people as well to move between countries. And in order for that to happen, the countries have to come together to negotiate and agree the rules that will govern those flows. And this can include things such as food standard regulations, what taxes or tariffs are paid on certain imports, what qualifications are recognised between countries, or environmental protections. Now, the UK government have been clear that trade agreements are one of their top priorities post-Brexit. And that means that they want to be negotiating as many new trade agreements as possible, as quickly as possible. And getting a trade agreement in place with the US in some form is one of their very top priorities. Now, this timeline on this slide is taken from the report I mentioned, and even though that was only published last month, it's already a bit out of date. And I guess the point there is just to kind of flag that these changes are happening and they are really happening at pace. So if, like me, you kind of thought that trade felt a very long way away from having an impact on health and well-being, hopefully I can explain otherwise. Because in fact, when you think about health from a wider determinants of health perspective, there are in fact many links into those factors that are out there in the wider world affecting our health and well-being every day. There are lots of different ways you can kind of categorize the wider determinants, but I'm going to be using this framework developed by the World Health Organization, which identifies kind of 5 essential building blocks for a healthy life. So income security and social protection, social and human capital. So those are the kind of whether you've got meaningful human connection and the skills and supports you might need to play an active role in society. So things like good education, health services, so the familiar stuff about treatment and care, but also prevention of ill health, employment, whether you have work, the type of work it is, what your working conditions are, and so on. And finally, living conditions. So whether you have access to green space, clean air, or whether your home is safe, warm and dry. Now, I imagine that list feels familiar to many of the people in this webinar. So let's sort of think now about putting that into the context of trade. This is kind of a list of some of the things that I guess we might expect to come as a result of a trade agreement. Most of us, I imagine, would associate trade agreements with economic growth, in part from new investment and in part from the creation of new jobs, because we now have new markets to sell our goods and services to. We'd probably also expect more affordable goods to come in from our new trading partners, and perhaps with that also people and new providers. Another important part of trade agreements is this potential change to regulations, so things like food and environmental standards that I mentioned a bit earlier. But how do these things track through to health? Let's take the economic growth and new jobs bit first. Say a trade agreement causes the economy to grow. That could mean that there is more money available to invest in public services like welfare, health and education, and this could lead to better health. With new jobs, we know that being in good, fair work has multiple benefits to health and well-being in its own right. And by having a better, more secure income, you can also free people of some of their money worries and mean that they have more to spend on sort of things that keeps them healthy, like good food and keeping their homes warm. With new people and providers, there's the potential, for example, to drive up the quality of health services or to enrich local communities. And with the regulatory changes that are negotiated, you could, in theory, see improvements to working conditions or environmental protections, again, protecting health. But these outcomes are by no means a given. Tight regulations tend to be seen as a barrier to trade, and given trade is all about making trade easier, it's more likely that regulations are weakened during negotiations, or at least can't be strengthened further once a deal has been agreed. And what if those weakened regulations coupled with more affordable goods actually means that it's easier to, for example, buy unhealthy products like junk food? That obviously would have a detrimental impact on health. And what if that more affordable goods actually also starts to undercut the goods produced here and squeeze local businesses so that they can't compete and maybe have to lay off staff? We know that unemployment has many negative impacts on the health and well-being of people and their families. Not least of these is the fact that they would then have less money to spend on the things that keep them healthy. And even having the economy grow as a result of signing a trade deal is not given. Sometimes countries sign up already knowing from their modelling that that trade deal is unlikely to have a big impact on their economies, and so on. So the true picture, I suppose, is unlikely to be trade having all good or all bad implications for public health. And within a country like Wales, it's very likely that you'll see some people reaping the benefits of a new trade agreement, while other people perhaps only experiencing some of the downsides, and therefore seeing trade having an unequal impact on health and well-being in a population. So trying to think about that more specifically in the context of Wales, I'd say some of the issues that look like they're going to be particularly relevant to Wales, but that also really illustrate that uncertainty point and the unequal distribution is employment and farming. We know that agreements with India and Australia and New Zealand, for example, include commitments to making it easier for people to live and work in the UK and vice versa for UK residents. But what we don't know yet is what sectors may benefit or lose out when it comes to people and jobs, and whether this will be a good thing or a bad thing for public health in Wales overall. However, we do know that farming has been consistently highlighted as one of the sectors most vulnerable to disruption. New trade deals have the potential to create new markets for Welsh products, which would obviously create big and important opportunities for farmers in Wales. But the trade deals the UK has struck so far are with other big farming countries like Australia, like New Zealand, and increased imports from these countries of produce like lamb could mean very stiff competition at home, undercutting Welsh farmers potentially and putting their businesses under pressure. We also don't know yet exactly where the UK government is going to land on issues like food regulations, for example, and these are very much going to be on the table with trade deal negotiations with the US. And the outcome of that will be relevant to Wales's plans to tackle obesity, for example. And the last one I wanted to highlight was climate change, which feels very timely given obviously COP26 coming to an end, with global commitments towards reducing carbon emissions. But these targets can really only be met if all of a country's policies are pulling in the same direction. And this does include trade agreements and trade, which can contain clauses which risk undermining those climate pledges. And I just wanted to quickly mention this example that came up during COP, if you hadn't already seen it. It highlights the fact that Welsh imports of certain foods from abroad is linked to deforestation. Obviously, we know the importance of that to climate change, but in addition, it's also having this direct negative impact on the well-being of the indigenous people who rely on those forests. And in this example, you can see I've highlighted in the article where Welsh Government has made some commitments to act on trying to remove deforestation from Welsh supply chains. When thinking about what trade means for Wales, I think it's important to note that as it currently stands, negotiation of trade agreements is done by the UK government on behalf of Wales. Welsh politicians can debate a new deal and discuss it, but they can't amend or reject an agreement. What Welsh Government can do is advocate for trade deals that work for Wales through the UK government by helping define their negotiating position, for example. But despite this kind of slightly limited scope for influence, the trade policy and trade agreements negotiated by the UK government do have potentially significant impacts on the business of Welsh Government and the Senedd. And of particular interest to us is how it might affect their ability to improve public health in future through new policy. There are two potential mechanisms for this, the detail of which I won't go into because it will be picked up by our other excellent expert speakers after me. but I just wanted to use this slide to highlight the fact that first, we may start to see the impact of trade agreements cropping up in our work in Wales because of how it may filter through those wider determinants of health to affect people's well-being in Wales. But second, that trade policy and the rules in trade agreements may also start to intrude on our work by affecting how able Wales is to introduce new public health policy. And at that point, I think it's hopefully a good time to hand over the story to Charles, who will be picking up the Internal Market Act part of the story in more detail. Charles, you are on mute.
Thank you. I was just asking whether my panel panelists tell me whether you could hear me, so that's perfect. So, thank you very much for inviting me here today to contribute to this excellent webinar, and good afternoon, everyone. My name is Charles Whitmore, and I'm a research associate with Cardiff University's Wales Governance Centre and Wales Council for Voluntary Action. So I coordinate their joint Brexit work. So I've been invited today to speak about the UK Internal Market Act, which I will refer to as the UKIMA for short. And its potential.
Can I just interrupt you very briefly? Yeah. We're only seeing a portion of your slide. We're not seeing the whole slide.
Oh. I will. Sorry about that.
Okay.
My window appears to have disappeared. Sorry about this. Would it maybe be better to jump my presentation and go to Courtney and switch up the order while I fix this, so we don't lose too much time?
Yes, if you'd like to do that, so we could do that.
Yes, sorry about this.
Move Courtney. Okay, Courtney, you're live now.
Okay, perfect. Everything look okay with the slides?
Yeah, perfect.
Okay, great. So, hi everyone, my name is Courtney McNamara, and I'm a senior researcher at the Center for Global Health Inequalities Research, based within the Norwegian University of Science and Technology. And it's really great to be here today. I'm really looking forward to the discussion that will follow. And what I'm going to talk about today is the UK's desire to join what's called the Comprehensive and Progressive Agreement for the Trans-Pacific Partnership, and what this might, how this might impact population health in Wales and the UK. So this is just a quick outline of what I'll be talking about today. I'll start off with some brief background information on the agreement. And then we'll do a sort of whistle-stop tour and consider some of the key health determining provisions of the agreement related to the 4 different areas that I've listed here. Now, the predecessor to the CPTPP was the TPP, or the Trans-Pacific Partnership, which was agreed in 2016 by the 12 countries listed here. And as you might already know, Donald Trump withdrew the US from the agreement in 2017 before the agreement was ratified. So following the US withdrawal, the other TPP signatories did agree to revive the agreement with only partial amendments to the original TPP. And in December 2018, the CPTPP came into force for the first group of ratifying countries. Now, in terms of background, there are at least 3 important key points to keep in mind. And the first is that with respect to the UK's accession to this agreement, things appear to be moving relatively quickly. So the UK formally asked to join the CPTPP February 1st, 2021. And already 4 months later, the CPTPP commissioning body agreed to formally start the negotiation process. And just a few weeks after that, the UK government published its negotiating objectives and its scoping assessment. And now we're starting to hear sort of government and media rumblings that suggest that the UK could finalize its accession by the end of 2020. Now, one of the reasons why things might be moving so fast is that the UK government is really constrained by the fact that written into the rules of the CPTPP is this restriction that any country wishing to join the agreement must sign up to the already agreed provisions. So the UK really has very minimal scope for a genuine negotiation here. And the last thing to keep in mind is that there's a question over whether the UK's desire to join the agreement is really an economic one. And the reason why this is questioned is that the UK seems to gain very little economically by joining. Now, by the government's own estimate, the deal will only add 0.08% to the UK's GDP over the long term. So looking at the long term, something like 15 years. So that was just a little bit of a background on the agreement. And now let's focus in on some of the particularly health relevant provisions of the agreement. And first, we're going to look at this issue that Louisa brought up briefly, investor state dispute settlement provisions. And these provisions are one of the most controversial aspects of the agreement. And really, the sort of rules around ISDS are found in a number of contemporary free trade agreements. And the initial idea behind them was to protect foreign investors from having their assets directly taken from them, especially in countries with weak judicial systems. Now, the CPTPP, like some other contemporary free trade agreements, takes a more extensive approach by actually allowing foreign investors to sue governments over some of the regulatory decisions that they believe might have or will compromise the value of their investments. So what are the health concerns here? Well, there's several criticisms of how ISDS presently functions in free trade agreements like the CPTPP. And 2 of the most important criticisms are that, first, a wide range of public health related matters have been challenged through the ISDS system. So this includes measures on taxation or health insurance or even tobacco control. Now, public health lobbying around the TPP did lead to a provision in the CPTPP that excludes any tobacco control measure from ISDS rules, but similar exclusions haven't or weren't made for any other public health regulation. Second concern relates to the fact that awards around these ISDS claims are getting increasingly large, where the average cost of defending governments is around the equivalent of £6 million, though often costs are much higher, and this is true even if the investor loses. So just by way of example, an ISDS case between Australia and Philip Morris, the Australian government actually spent approximately £12.5 million defending this claim brought about by Philip Morris, despite the fact that Philip Morris was not successful in this claim. Okay, so let's move on to talk about regulatory measures. Now, regulations around things like the production and sale of tobacco, alcohol, and food are governed by rules which relate to what is known as sanitary and phytosanitary measures, or SPS, and what is known as technical barriers to trade, or TBT. And in short, these rules set out, first, the terms for how governments can use public health measures to restrict trade without violating trade rules. And second, the types of technical regulations that can be placed on goods for reasons of health or security or environmental protection. Now, these rules, for example, relate to public health measures like the limits on pesticides or the limits of certain residues in food. And they're especially relevant to labeling requirements on products like tobacco, alcohol, or unhealthy foods. Now, what are the main health concerns with respect to rules laid out around these issues? Now, a primary concern is that they effectively rule out the use of the precautionary principle. And this is because they require that new public health measures like labeling requirements be based on what the agreement specifies as documented and objective scientific evidence. Now, this framing is a significant departure from the rules in the WTO or in other EU negotiated agreements, including the ones, including the UK rollover agreements. And these agreements in the WTO or in these EU-based agreements make much greater allowances for the use of the precautionary principle. Another major public health concern here is that some of the language in the agreement could lead to increased corporate involvement in policymaking. Now, specifically, the CPTPP includes a provision that each country should allow persons of the other countries to participate in the development of regulations. And then we see in the general definitions of the agreement that a person of another country is noted to include a multinational corporation. So we'll quickly move to talk about medicines and health services. Now, effects on medicines and health systems are laid out in rules around intellectual property rights and trade and services. And in relation to intellectual property rights, the main concern is that text in the agreement effectively locks in some patent protections for some of the most costly drugs out there, known as biologics. Another concern is for medicines more generally, where the agreement has been criticized for providing pharmaceutical firms with a way of continually being able to continually extend their patent protections without really adding any innovation to the drugs. And this, of course, could lead to a delay of using generics and, of course, translate into higher costs for the NHS. Finally, given that the UK is believed to have very little scope for negotiation, and related to the ways that the rules are laid out for trade and health services, there's a question whether the government's promise that the NHS is not on the table is one that can be realistically realized. And I'll just wrap up by talking quickly about some of the labor and environmental provisions within the agreement. Now, the main point here is that all of the rules around labor and environmental standards are far from the gold standard that proponents would like to have you believe. With respect to labor, there's really no obligation for countries to ratify any of the ILO conventions. There's no obligation for countries to sign up to any multilateral environmental agreements that they haven't already signed up to. So in short, countries only need to uphold their existing commitments, and really there's no floor below which their regulations around work or environmental standards should not fall. Finally, countries can only dispute violations around environmental or labor provisions when trade or investment between the parties is impacted. So this means that a country can violate its labor or environmental standards without another country being able to raise a dispute against that unless that violation affects trade. So I'll just stop here to not run over into our discussion time, but I've listed here a two-part glossary that colleagues and I have published that goes into greater details about some of the issues I've talked about here. Along with a piece in the BMJ that outlines how an agreement with the US would limit the UK's ability to manage NCDs. And it's noteworthy here that many of these arguments that I make in this piece also apply if the UK joins the CPTPP. And I'll hand over back to you, Karis.
Thank you, Courtney, for that really interesting presentation and making that really clear for us in terms of some of the drawbacks and criticisms of some of these policies. Charles, I can see your PowerPoint is looking lovely and ready to go, so I'll hand over to Charles.
Thanks very much, Okay, so can I just confirm that you can now hear and see me okay?
Yeah, that's perfect. Thank you.
Okay, fantastic. Okay, so sorry for that brief technical glitch, everyone. So, yeah, I've been invited to join today to speak about the UK Internal Market Act, which I'm going to refer to as the UKEMA for short, and its potential impact on public health policy in Wales. Now, I would preliminarily like to say that I'm not an expert on public health policy. My work is more on the constitutional and legal ramifications of Brexit. So my aim here today is to provide a basis for others with more specialist knowledge on public health to be able to consider the interactions between the Act and policies on health and in its wider determinants. So I'm going to talk us through quite a technical and to be honest, rather dry and boring piece of legislation that nevertheless really punches above its weight in terms of potential implications. And I'll try and provide some examples of potential or hypothetical policies that relate to the wider determinants of health that Louise has been talking about, and talk through some of the basic reasoning on how the Act might apply to them. I very much say potentially because we don't yet fully understand how this Act is going to impact on policy and practice and over time. So to start off with a little bit of context, the legislation has stemmed from a perceived threat that competencies returning from the EU to the UK in areas that have been devolved would lead to or could lead to an overly fractured regulatory landscape in the UK that is theoretically detrimental to intra-UK trade in goods and services. So where Louisa and Courtney have been talking about international trade, I'm bringing it back and we're talking about trade within the UK between Wales, England, Scotland and Northern Ireland. So to give you an example, if Wales introduced a new requirement around labelling of specific products or on the composition of products sold in Wales, a specific product sold, the concern is that products from other parts of the UK would have to comply, thereby resulting in increased compliance costs, or that those products could not be sold in Wales, and that would be detrimental to the economy and to business interests.